Medical simulation has been a training method since the early 1900s and can take many forms, ranging from mannequin trainers to live actor scenarios. Simulation education is important because it allows doctors to gain practice experience on various procedures without putting patients at risk before they're fully trained. One common medical procedure, central venous catheterization, or CVC, is primarily trained via mannequin simulators. The CVC procedure is where a doctor inserts a needle into a vein, usually in the neck, and uses that vein to gain access to the heart for critical medicine delivery. CVC has a high associated infection rate and mechanical complication rate. While mannequin trainers are beneficial, they lack both in direct feedback and anatomical variation. A team of researchers developed the Dynamic Haptic Robotic Trainer, or DHRT, a simulation-based training system that relies on force feedback from a robot to recreate CVC and allow doctors to practice on a variety of anatomies. This system has been proven to train medical residents on CVC, but we believe that it can be even stronger with the implementation of eye tracking. Eye tracking systems have the ability to track eye movement and fixation, allow a review of performance, and have been proven to distinguish between expert and novice performance in central venous catheterization. This semester, we worked virtually as a team with our project sponsor, Dr. Jason Moore, and Professor Dr. Scarlett Miller to brainstorm and recommend the best way to implement eye tracking into this simulator. CVC is an ultrasound-guided procedure, and as such, the person performing the procedure needs to be able to move their eyes between the ultrasound screen and their hands at appropriate intervals. This is where we believe that eye tracking would be able to come into the system, but the first thing we wanted to do was talk to our main users and stakeholders to better understand their needs in CVC training. 5 total expert doctors coming from Hershey Medical Center in Pennsylvania and Cedars-Sinai in California, and 5 novice doctors from Hershey Medical Center were interviewed over Zoom. After undergoing content analysis and transcript coding in vivo, several main ideas came up that would help us figure out how to implement feedback from an eye tracking system into this simulator. From the experts, we learned that one of the biggest differences between expert and novice performance in CVC is whether they spend more time looking at their hands during the procedure or at the ultrasound screen. Experts have better hand-eye coordination and do not need to look at their hands as often as novices. The novice learners thought it would be helpful to review their performance with actionable feedback shown in real time and have an expert performance eye-tracking example for them to watch as a reference. Based on these ideas, we developed a low-fidelity prototype using PowerPoint and came up with several tasks to test how easy or difficult it was to navigate. These tasks included turning on eye-tracking mode, navigating through the instructions, going through a trial of the simulation, and reviewing the trial that was just done. This gave us an idea of how a user would interact with the system, and we were able to utilize peer feedback from class to upgrade this prototype to a medium fidelity version in Adobe XD to use with novices in a small usability test. In the new version of the prototype, there's an option to review one's own performance as well as an option to review an expert's performance, which are both items from the novice interview. From the expert interviews, time spent looking between the ultrasound image and the procedural field was noted to be very important, so we included some metrics on gaze patterns as well as a visual heat map. Feedback from this study has shown that parts of the design are not intuitive, and that while we tried to incorporate more integration between the DHRT system and the new system and the medium fidelity prototype, it was still confusing for the user. The future of the design should focus on the further integration between the eye tracking interface and the DHRT system interface. Additionally, more research should be conducted on the inclusion of real-time feedback during eye tracking simulation to best incorporate this into the future design.